frontal bone, 2 parietal bones, the occipital bone, the external occipital protuberance, and that leads to the attachments for muscles and ligaments to hold up our heads. The temporomandibular joint, the mastoid process, the styloid process, the external acoustic meatus, and the smooth squamous part of the temporal bone. It's the temporal bone. The petrous part of the temporal bone. And this is home to the internal ear apparatus for hearing and balance. This is the internal acoustic meatus. And it's cranial nerve 7 and 8 that pass through this. This is the sphenoid and the external view, the superior orbital fissure right there. Such structures like the cranial nerves, frontal nerves, superior orbital vein, and superior ophthalmic vein pass through here, among many others. And the greater wing is also in there, as well as the lesser wing, a little bit behind it. And the greater wing and the lesser wing and the greater wing, with the greater wing being a little bit in front of it. It's sphenoid bones with the greater wing a little bit further back and the lesser wing more close to the eye. This is the optic canal, and it's the canal through the lesser wing of the sphenoid bone at the apex of the eye and apex of the eye socket, actually, where the optic nerve and ophthalmic artery pass through, and the sella turcica of the sphenoid bone is back behind the optic canal, and this is where the pituitary gland is supported. The crystal galley, if we cut this in half, we could see the process which takes place between the cribriform plates. The crystal galley is where the covering of the brain attaches and helps secure the brain into the cranial cavity. And the cribriform plates allow the filaments of the olfactory nerves to form cell receptors in the nasal cavities to the brain. The coronal structure, or coronal suture, sagittal suture, lambdoid suture, and the squamous suture. The maxilla has sockets for the teeth, and the nasal bone and vomer connects with the perpendicular plate and the ethmoid bone. Inferior nasal concha, and these are able to be separated. The zygomatic arch is formed by the maxilla and the zygoma. So the mandible, here is the body, the angle, the ramus, the mandibular notch, the mental foramen, the coronoid process, and the mandibular condyle. In the vertebral column, there are 4 types. There is the cervical curvature, and there are 7. And the atlas, it has no body or spinous process, but in this, in so many words, it carries the skull. So the axis acts as a pivot. It allows us to turn our heads like that. Something that is unique, what is unique is that each transverse process contains the transverse foramen, and through which is where the vertebral arteries can pass through the brain. This is the thoracic and the spinous processes and the transverse process. The intervertebral discs, which is where the spinal nerves issuing from the spinal cord pass through. Intervertebral discs which is where the spinal nerves issuing from the spinal cord pass through. The body. The position of the intervertebral discs. The lumbar vertebrae. Right here. Lumbar vertebrae. Lumbar vertebrae. There's 5. The sacrum. It's 5 fused vertebrae, and the coccyx. This is the thoracic curvature. There are 12. The spinous processes. The thoracic curvature has 12 vertebrae. The spinous processes and the transverse processes. The intervertebral discs, which is where the spinal nerves issuing from the spinal cord pass through. The body. The position of the intervertebral discs. The lumbar vertebrae. The sacrum and the coccyx. And the sacrum has 5 fused vertebrae. Sternum. It's a manubrium. The body. The xiphoid process. The jugular notch. The vertebrosternal true ribs. The false ribs, which are the vertebrocontral ribs, including the floating ribs.